Hello, I'm Xue. I'd like to introduce a research from Mr. Maya. The title is A Simulation Model of Analyzing Medical Cooperation of Daytime Community Healthcare. According to OECD report on health measuring healthcare, the current system of medical service in Japan is encountering the problems, like the excessive number of sick beds and overlong average length of hospital stay. Why occur such problems? One of the main reasons is expansion of medical institutions with reorganization of medical system. With the development of medical institutions from 1960s, the overall number of sick beds were increased 300,000 per 10 years. Furthermore, the elderly hospitalization problems appeared to a large extent. Although it is desirable that all the elderly patients ought to receive the treatment in appropriate hospitals, the reality cannot go in as we imagine it would be. In the ideal case, we propose a medical treatment can be ended in one hospital. That means only one department of a hospital is in charge of the execution of treatment. But it is hard to be realized in reality, so that the waste of medical resource is brought out. To solve such problems, government in Japan has promoted a serious medical law reform. In 1985, necessary sick bed numbers and the cooperation relationship between hospitals is regulated in medical plan. For another, in the end of 1990, medical cooperation critical path has been promoted. Moreover, from 1992 to 2000 years, second, third, and fourth medical reforms focus on the excessive number of sick beds and advances in sick bed regulation. In the near past, 2006, fifth medical reform put the emphasis on promotion of specialization and cooperation in medical care functions by enforcement of medical cooperation critical path. Purpose of this research can be summarized into the following two items. First, simulate the whole process of daytime community healthcare and build up a model for evaluating the actual medical cooperation systems. Second, also the most, apply the model to a real second medical area as a case study and analyze the impact on cooperation network of hospital of the whole target area after enforcement of the policies in the model. This is an image of the model. At the first step, we construct a virtual city model. Here, like the imitation of real world, we have hospitals, clinics, schools, and a lot of places like the reality. We also implement a medical system module to the virtual city model. The main actors in the module is home, rehabilitation, hospital, and clinics. No doubt, there are a number of relationships between each other. In the whole model, we set the action of each agent and the order of period conditions to regulate the action role of individual. For example, like the table. If department in the hospital can deal with the disease, agent is likely to go to hospital by walk. For another instance, if the hospital is the nearest one and have vacant sick bed, agent is decided to go to the hospital by ambulance. The other case can be deduced by the table at the same. As a simulation readout, we choose 3 hospitals, which are the most popular or main hospitals in this area. The sick beds of each hospital is listed as a slide. The first picture shows the utilization rate of normal sick beds per year, and the second picture shows the utilization rate of rehabilitation sick beds per year. It's 94.5%, a really high number. According to the result, the current state in this area encountered problems like excessive number of normal sick beds results in low utilization rate, and the current number of rehabilitation sick beds cannot satisfy the need. By the way, the result from the model is access to the data in reality. The data is showed at the table in the left. As a result, medical cooperation cannot take the role in the existing medical system. To solve such problems, we must to consider a new way. Here we propose to adjust the sickbed numbers to release the burden of hospital systems. We change the number of each kind of sickbeds. For example, Hospital A holds the largest number of normal sickbeds, and instead no rehabilitation sickbeds. We let it decrease from 339 to 189, and also change the normal sickbeds and rehabilitation numbers for another hospital. We apply these scenarios to the model. The result is like our imagination. The use of normal sickbeds has been increased by 13.4%. On the contrary, the rehabilitation sickbeds is decreased by 2.4%. Besides, we considered it to another scenario, like predict the data in the future, accompanied with an aging society with lower birth rate. The table lists the present number of people and the data after 20 years. As a result, the utilization rate of normal sickbeds is 78.2%. On the contrary, the rehabilitation sickbeds is 86.9%. Depending on the model, we also get the information like pediatrics, gastrointestinal division of normal sickbeds in hospital age will decrease by 18.8%. Also, gastrointestinal division and respiratory division in hospital C will decrease by 14%. Conversely, hospital I's utilization will decrease by 10.9%. Hospital M's utilization will decrease by 8%. And overall, the whole state in this area can be summarized as the first, utilization rate of hospital will impressionable. Department is seldom changed. And second, utilization rate of hospital without impressionable. Department is dropped sharply. The most hospital or clinics have been affected is likely to be the hospital where the patient easily gathered, and another hospital without vacation sickbed will transfer the patient in. As a conclusion, from the model we can claim that, first, the model is able to successfully reflect the current medical system, and for another, simulation results point out some factors which ought to be taken into consideration for future medical institutions by comparing the simulation result with the real data. And furthermore, utilization rate of sickbeds in the target area is improved by implementing reorganization sickbed scenarios in the model. And the last one, reasonable arrangement of departments in the hospital is important in reorganization of sickbed. Thank you for your attention.